Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing in our discussion of endocrine pharmacology, and next up is a discussion of the drugs that we use to treat autoimmune disease. Now, autoimmune diseases come in a wide variety, as I'm sure you know. And the two most common autoimmune diseases seem to be things like lupus, as well as ulcerative colitis. But don't forget rheumatoid arthritis as well. Now, for rheumatoid arthritis, we have a whole collection of drugs as a group that we call DMARDs, disease-modifying anti-rheumatic drugs. Now, what do they do? How do they work? Well, we're treating an autoimmune disease, so the basis must be what? Shut down the immune system in a way. So what these drugs do is suppress overactive T-cell response and therefore suppress the underlying inflammation that goes along with that. In so doing, we're attempting to what? Reduce and prevent joint damage and at the same time preserve what joint structure and function we still have. But that's easier said than done because autoimmune diseases are relentless. It's your body's immune system destroying your own joints. So we use a rather eclectic group of drugs to do this. Things like anti-malarial drugs like hydroxychloroquine or Plaquenil, which should sound familiar to us post-pandemic, okay? We might use a drug like methotrexate, a true antineoplastic agent, which in low doses is also effective in treating rheumatoid arthritis. We might use steroids, adrenocorticosteroids, because again, they also suppress immunity and therefore inflammation. Or we might use a tumor necrosis factor alpha blocker like Humira, again, since tumor necrosis factor alpha is an inflammatory mediator. So we have lots of medications in this class. Again, eclectic, but certainly all aimed at the same purpose, which is to reduce immune response. But remember, my friends, especially in the world of dentistry, suppressing immunity means what? Increasing susceptibility to infection, right? And what else? Increased difficulty with healing, so decreased wound healing. So that's a problem in dentistry because, again, much as I love everybody in dentistry, I'll always say it, we work in a cesspool, right? We work in a fluid medium full of bugs that would love to get a foothold. And in that cesspool, if you will, we inflict damage to tissues. So we're opening wounds, and it's a wonder we don't get infection all the time, right? So, especially if the patient's immunocompromised, that can increase that risk of secondary infection and opportunistic infection like candidiasis, fungal pharyngitis, and even viral infections. So, great drugs to treat autoimmune disease, but they have some side effects that can affect the oral cavity and dentistry as a whole. Well, that's it for this episode of Fast Facts Pharmacology, my friends. Join me next time for our next series. Till then, this is Tom Viola. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.